Hi everyone, Dr. Nemechek here. I want to kind of delineate the difference, like the mechanics of what's diarrhea and what's constipation. People think it's kind of the gut's going too slow, constipation, the gut's going too fast, diarrhea. And that's, for the vast majority of cases, that's not true. That's not true. Okay. First, let's talk about where these problems originate. If you have diarrhea, you have irritation, typically, in the small intestine. Now, let's get rid of people who can't digest lactose, okay, because they're going to have a unique problem. Aside from them, most people are going to have inflammation or irritation in the small intestine or in the large intestine. This can be from bacteria, this can be from parasites, this can be from a non-infectious thing like Crohn's disease, all right? But that's where it's coming from. And when you have irritation and often when you eat, you can't properly digest it all. The bacteria get involved with digesting this unabsorbed nutrients. That'll give you diarrhea, or just some of these inflammatory conditions. You know, the colon's major job is to regulate water, and it can't do that right. So you'll be losing water into the stool, making your stools looser, liquidy, maybe normally formed, but just frequent. All of those are diarrhea, okay? Or even, my stools are okay, but if I eat, I got to go to the bathroom. I got to go have a bowel movement. That's all diarrhea, okay? It starts in the intestinal tract, all right? And the solution needs to be focused at the intestinal tract. Now, constipation is predominantly a neurological problem. It can start in the intestinal tract. Sometimes, and this isn't common in kids, probably more common in adults, you get a organism called archaea up here. Archaea produces methane, and the methane affects the nervous system, all right? And that will slow the gut down. Most commonly for people with chronic, like, I had constipation for years, just getting worse, or my child's had constipation, since they were 1 and the kid's now 6. Those are problems where you have a unresolved injury in the autonomic nervous system up here, up in the brain. That's where it starts, okay? Now, trying to solve these problems, if you have diarrhea, say, from some organism overgrown in the small intestine. Now, this could be SIBO, like we talked about. This could be Giardia from well water. When you take the appropriate antibiotic to rebalance this, your symptoms get better in days to weeks, very quickly, okay? Because those treatments will get you back. The gut heals very quickly. Things regulate now more normally, days to weeks, okay? If you have constipation that's coming from here, the way you have to fix that is reduce inflammation, and now that's what our protocol does, right? We stop leaky gut, we use the fish oil and the olive oil and the vagostimulators to reduce total body inflammation. The constipation part will improve within 1 to a couple months. It's slow, okay? Now, so diarrhea originates in the small intestine, gets better quickly. Constipation typically originates in the brain, gets better slowly, and many people have both. And when you have both, they can kind of cancel each other out. So some people are like, constipated some days or a day or two, and then I'm kind of loose and back and forth, or they just don't pay much attention. Or if it's your child, you're really paying that much attention, but they're going every day or two, and so you aren't worrying about it, okay? And so what will happen is, when we're trying to lower inflammation and get the brain better, we use rifaximin to stop leaky gut. And that leaky gut is coming from bacterial overgrowth. Here. So we give them, and so they have constipation from the brain, leaky gut from the diarrhea from the gut, that kind of balance each other out. And when you use rifaximin, the diarrhea part goes away within a few days to a week, and suddenly the constipation seems worse. All right? Rifaximin or inulin didn't cause constipation. What they're really doing is removing diarrhea underlying that, okay? Because I've had people like, or even glutamine, okay? Take glutamine, oh, it caused constipation. That's a good sign. That means it got healed and diarrhea went away. You're just left with the underlying neurological problem. And people are like, well, I don't like that, and whatever, it's uncomfortable. We just got to work through it. You got to take something for the constipation for the next couple months, but in concert with the fish oil, the olive oil, balancing the gut, maybe the vagal stimulator to get your inflammation down so this part of the nervous system recovers. And then all of it will be gone. All right? And so, again, constipation, slow motility of the gut, it's coming from the brain, can take 1 to a few months to recover if you get the inflammation down. Diarrhea, or frequent, or loose stool, however you want to phrase it, it's originating in the intestinal tract and typically gets better in days to a couple weeks with treatment there. So, anyhow, I hope that helps everybody. Remember to hit subscribe, and if you need some fish oil and olive oil or a vagus stimulator to help your brain recover and get rid of that constipation, look at the links below and you can find our products that we offer. All right, everybody take care.